Today we will be reviewing how to splint and immobilize a long bone injury. Remember, when splinting a long bone, the splint should immobilize the joint above and below the injured long bone. Have your partner or the patient stabilize the injured arm. To help reduce pain to the patient, the EMT will assess the injured extremities' circulation, motor function, and sensation. The pulse can be assessed by palpating or checking the capillary refill distal to the injury. Motor function is assessed by asking the patient to wiggle their fingers on the injured extremity. And sensation is assessed by asking the patient if they can feel the EMT's palpation or by touching the patient's finger and having them localize the sensation. The injured long bone needs to be immobilized using a rigid or vacuum splint. If using a rigid splint, first, size the cardboard to the length of the forearm and cut off any excess. Then, apply padding to the splint using a towel or a small blanket. The arm should fit in the rigid splint without excess movement. Then, apply tape to secure the splint together. Remember to ensure the splinting reduces forearm movement as much as possible. Assess the patient's circulation. Motor function, and sensation. If using a vacuum splint, select the most appropriate size to cover the patient's forearm and elbow, reducing both wrist and elbow movement. Apply the vacuum splint. And remove the air from the splint using the provided pump. Then, secure the Velcro straps. Remember to ensure the splinting reduces forearm movement as much as possible. And finally, assess the patient's circulation. Motor function, and sensation. Thank you for reviewing this Falck Health Institute skill video. Please like and subscribe for future videos.